I have hypothyroidism, no gallbladder. I bought Atrantil. Will it kill methane with the Alimed, or do I use a different herbal with Alimed? Thank you.
So Atrantil has a mild killing effect, and more so what it's about is stopping the production of methane by the bacteria archaea. And it doesn't really matter if you're, the key, you don't have to kill the bacteria. The key is to not have the methane be produced. It's the methane itself that causes the symptoms. So, and all the aggravation, but it does have a mild killing effect. So you can use it combined with, you can add it with your Alimed, but typically we use it with the then hydrogen killing herbs, because there's always hydrogen present when there's methane present. So that would be oregano, berberine, or neem. So you combine the Atrantil with one of those, but you can also just do Atrantil all by itself if you wanted, just to control the production of methane, and do your before and after tests. And then if Atrantil is successful in symptomatic control and also on the breath test, you then want to continue it because maybe the bacteria aren't all killed, right? And so then you want to continue it at a low dose because it will continue the inhibition of the production of the methane gas. So anywhere from 1 to 3 a day ongoing, if it worked for you.
Would Atrantil make symptoms worse in some?
The only way I could see that possible is, well, anybody can react to anything, right? So an individual, obviously putting that aside, an individual reaction, but would be die off if there is some kind of, because it does have a mild killing activity. And they're very tannic herbs, and tannins can bother people. So yeah, of course it's possible. I mean, really, I have a sensitive population group. I see reactions to everything that I give, and then you've got to fiddle around. So you just move around to something else if it bothers you. And the other thing I want to just say about that for anybody who finds they react to things often is in more sensitive people, oftentimes there are a lot of confounding factors. I'm a sensitive reactor, so I'm speaking from my own experience. There are so many confounding factors that influence us in our lives on a daily basis that we try something and we ascribe it to a certain thing. You have to try it 3 times before you can be sure it's that thing causing the problem. And I have to tell you, 70% of the time, when I think, a doctor, when I think something is the cause of something and I try it the second and the third time, I find out it wasn't. And it was confounding factors. You really have to try things a few times. That takes time though, because you got to give it a day or 2 for the reaction to calm down. You try it again, and it takes time to figure all these reactions out. So anyway, yeah, it's possible.
Are you saying if Atrantil works, it should be continued at a low dose? Is that instead of a prokinetic or in addition?
Yes, I am saying that. That is the way we do it. And I do talk about that in the course. Because of its mechanism of action. So Atrantil, because I explained, it has only a mild killing and it more is inhibiting the gas. So therefore, because of that reason, if it's successful in you, you have to continue it to have that success continue, because it's only as you take it, it inhibits the production of the gas by those archaea or bacteria. So yes. And the other part of the question was, it's not in
That's
place
what
of
I was shaking my head. No,
It is not a prokinetic. You additionally need the prokinetic. Yes.